Hey, how's it going?
Hey, it's going well. How are you?
Good. Can you hear me okay?
Yes, I hear you fine.
Okay, sounds good. So just to introduce you in case people don't know who you are, so Dr. Seth Berger, a psychiatrist on the Upper West Side of Manhattan. And I know that you have like a niche kind of specialty in your field, but I know this is maybe just a little bit outside of that, but obviously you have like so much knowledge and so much to offer here. So I wanted to pick your brain about some of this stuff if that's okay.
Yeah, awesome, definitely. And it's actually funny. So when I was growing up, I
Mhm.
was bit by a dog when I was young. And
Okay.
after that, I had this amazing like interaction with this plastic surgeon, Dr. DeVita. He was in Great Neck. And
Ah.
after that, it was like my whole life, all I wanted to do was be a plastic surgeon. That's why I went to medical
I didn't
school.
know
I was so
that.
excited. Yeah, so it was like such one of the biggest things that, got me into medicine was that I want to be able to help people. And I thought
Right.
plastic surgery was just a great way to help people. And
So
then
why did
I
you decide
obviously,
against that?
so I realized I had absolutely no talent when it came to art and the hand-eye coordination, all those things. It just wasn't my calling. So I love psychiatry, and that was something that really was what I was most interested in. So this comes full circle. So this is my way of helping people, of having
That's
some
so funny. I
hardships.
had no
Yeah,
idea, Seth. That's
yeah,
hilarious. Well,
yep.
I was a psych undergrad, and I was always interested in learning about like how people make decisions and how they think and all of that. And I think that's partly what drew me to plastic surgery actually, because there's a lot of psychology in it, and it's like I'm not treating them with medications, but I feel like sometimes I'm treating them with a scalpel. And, there's like sometimes a fine line, right, between like giving them what they want versus like, what I think is aesthetically pleasing versus like what society sees as acceptable. So, yeah, so I thought like this was going to be a really interesting topic and something that my wife advised me not to do. She's like, well, you're going to scare away patients. You're going to, you're going to tell them that, what you really think. And, I don't think there's anything wrong with kind of putting it out there for people to, to give their opinions and see where they stand on this, because it's something that we're taught like informally, like during our training for plastics, and then you hear all these like, tales from like the wiser older doctors about, like those red flags to watch for, and people have like tried to study it in our literature and have come up with like different surveys and ways of being kind of crafty, but it's always like kind of hidden from the patient.
Hmm.
But I don't think there's anything wrong with sort of telling them sometimes what you're thinking. But yeah, I mean, I guess we can just jump into it. So I wanted to start with sort of what motivates people to get, especially like cosmetic plastic surgery. Because when you have the dog bite, I mean, it's very reasonable to most people that you'd want to be corrected back to how you looked before the dog bite, especially as a kid. But what some people don't understand is like, kind of more cosmetic, aesthetic procedures where it's like completely elective. Like people, they look fine, but
Hmm.
yet they want something adjusted. Maybe it's because of, the aging process and something sagging now. They still look fine, but they look different than how they looked 20 years ago. Or they like, they like a certain person on TV and they're like, well, when I look at myself in the mirror, I see a thin lip and that person has a big lip and everyone likes them, so I want to be more like them. And then they want a little sort of enhancement or a little tweak. And so, the way I see it, most of the patients who come to me, they really do just want like, a little bit more self-confidence, kind of a self-esteem boost. And they're not asking for anything drastic for the most part. And they're usually very realistic with me. I tell them the risks, they understand them, and most of them end up pretty happy with their surgeries. But again, that's the majority, and maybe I'm
Hmm.
fortunate in my practice. I think I scare away some of those who just they have money and they want to pay, but they want like insane overhauls, and I just I ask them a lot of questions. I talk to them a lot, and I think some of them sort of they're like, wait a second, he's asking too many questions. I gotta go find someone else. But that's been my experience. I
Yeah.
don't know if you've dealt with it on your end
Hmm.
of things, but I'd love to kind of hear
Yeah.
your thoughts.
No, I think that from my experience with people that are going for plastic surgery, I mean, they have the body image dissatisfaction, right? I mean, they want to look more normal, whatever normal is to them. They just don't want to stand out in an obvious way. They don't
Mhm.
want people to comment on them. They don't want to feel, more self-conscious, or they just want their physical appearance to be more in line with the way that they, feel like their personality is. So they want some kind of, there's a mismatch and they want to, make it feel better, make it match. I think that there's, this, we call it like the halo effect. It's, the way that people are hardwired to have this positive response to physical attraction. And, when you see there's a cognitive bias, if there's a positive traits in one way or another, you kind of get this overall positive valuation of somebody. So, if you see somebody who's physically attractive, then you feel like they're more intelligent or more trustworthy. So a lot of people would say, well, who wouldn't want that, right? I mean, doesn't want to reap the benefits, from the halo effect, so that strangers or colleagues or other people, just feel or say, more positive things about them. So I think that it's a combination. And a lot of my work is where, in therapy, I'm trying to separate people's emotional well-beings from others' perception. So, if it's all about what other people think or about what a relationship, thinks of them, it's a lot harder because, you can't fix a relationship with some kind of cosmetic surgery. So, my job is to try to improve their self-esteem and their self-confidence internally from what they think and what they feel about themselves, rather than having it rely so much on what other people think from a surgical aspect. So I think that there's all different reasons why people get surgery. When I'm hearing it and that's about, I need to have this surgery done so this person thinks I'm more attractive, or it's going to help the relationship, or, it's going to make my life much better, then it's kind of, more of a red flag for me. Okay, let's take a pause. Let's try to work on this. Let's try to figure out really what's going on and process it without needing to run to get a surgery, which likely will not fix that problem.
Right. So that leads into the next question of like, pretty much you answered it. If the reason for wanting the surgery matters, and it sounds like it does, and I hear you loud and clear that if the person just wants it for themselves, that they, whatever research they did or whatever they're seeing in the mirror, but if they just want to kind of better themselves or what they think would be better with surgery, that's one thing. But when they're doing it to, appeal to someone else's desires, perhaps that's not the best reason or motivating factor.
Right, exactly. I mean, it's interesting. We talk about this in psychiatry with the ethical question. If somebody comes in to see me and they want a stimulant, and they say, well, I don't really have ADHD. I just want a cognitive enhancer. So ethically speaking, well, they don't meet the criteria for ADHD, but they want something that's going to help them, think better, think more clearly. Is that okay? What does it matter what their reason is for wanting it? And oftentimes we'll turn to plastic surgery. We'll say, well, hey, if somebody wants a nose job done, but their nose looks perfectly fine, is a plastic surgeon going to say, this isn't really what the nose job is for, and we don't really think it's necessary? They say, well, you know what? Let's weigh the risks and the benefits. Let's make sure it's something that makes sense, that you understand. And if it's going to make you feel happier, then, you should have that. So it's different with plastic surgery than it is obviously with stimulants, with medication for ADHD. But I think that the number one goal is to just make sure that we're not doing any harm. And if the person understands all the risks and they know what goes into it, and they have a really thought out way of thinking why this plastic surgical procedure is going to benefit them or make them happier, it's a reasonable thing to consider.
Right.
The caveat is in terms of, body dysmorphic disorder, is that people believe that they have this problem or this defect, and you could have as many surgeries as you want, but it actually can make them worse and worse and worse because they have the surgery and then it draws more attention to them and they spend more time, obsessing over it. They get angrier. They think that the surgery, they put all their eggs in this basket. They thought it was going to solve the problem. And it actually has a rather high suicide rate. If people who have body dysmorphic disorder end up having multiple plastic surgeries that ultimately don't solve the problem that they're trying. So in that situation, I think it also matters a bit more because you don't want to do more harm. But as long as you're not doing more harm, why should we tell them, what we think is ultimately going to make them feel better when really we have no idea?
Right. So for the body dysmorphic disorder, since you brought that up, I mean, is there, like, how do you treat that on your end? Is it all through therapy, or are there medications for that?
Yeah, body dysmorphic disorder is very, very challenging. So, I mean, the gold standard is both. It's a combination of SSRI, selective serotonin reuptake inhibitors like Zoloft, Prozac, Lexapro, Celexa, at rather high doses. And then in combination with cognitive behavioral therapy. I mean, really good exposure work is very, very helpful. So people can definitely get treated and get treated rather well for it, but it takes a whole lot of work, a whole lot of effort, both from the medication standpoint and the therapy part, where you're really putting yourself in uncomfortable situations and putting in a lot of effort and time on it. So, once you're able to really work on the BDD and hit that from both the therapy and the medication aspect, you definitely can get better. But there's a really high, I think the suicidal ideations in people with BDD is, over 75% that they have it over the course of their lifetime. Suicide attempts are over 20 to 25%. So it's rather high. It's really, really risky. And oftentimes, I'm sure those are the people that you'd see who come in for multiple surgeries or who try to fix things through surgery as opposed to working in therapy and medications. And it's almost always a letdown because there's almost nothing that you'd be able to do surgically. You can do the perfect surgery for them, but they're always going to find something else to focus on, or always going to think that it's not good enough, or always going to then use something else as a distraction to, kind of refocus them in a negative way. So they're really not going to get better from the surgical standpoint.
Yeah, yeah, great way of describing it. So what I've noticed in my practice, in the last 2 years, is that the people who come to me from other really good surgeons in town, where they've paid top dollar and they now want a revision procedure. There are times, when we're not perfect. I mean, sometimes and the healing isn't always perfect. So there are some justifiable reasons for wanting a revision. But again, a lot of these surgeons are very good and their results are quite predictable, but they're still unhappy. They say, oh, I have this scar, and you look and it's really hard to see. And I tell them that I don't think I can make that better. And some of the patients are, really distraught by that. They just, they kind of keep going to the next person who's going to, repeat the surgery and repeat the surgery. And so I think I've just noticed a trend, amongst the patients who I don't operate on. And it's a lot of those patients and they're ready to pay, but I just don't really want to deal with a lot of that. So, but yeah,
And
so
it's
that's,
probably a good idea because ultimately, while they're willing to pay for it, it's going to end up in a huge headache. They're going to want repeat surgeries. They're never going to be happy. They're going to be angry. They're going to take it out on you. And there's really no winning in that situation. So
yeah.
I think that, you'd handle it appropriately. That rather than saying, hey, you have BDD or you need therapy or this or that, they're not going to listen to that. They're not going to want to say, okay, sure, you're right. Let me go get therapy and then come back.
Right.
I think from your standpoint, if you have a relationship with them, if you've seen them a few times, that's one thing. But I think by just telling them, hey, there's just nothing I can do to make that situation better. You blame it on yourself. I just don't have the skill set to make that the way that you want it. It just, kind of decreases the anger and the hostility so then that's not displaced on you. And then it's, up to them to ultimately, if they seek enough of surgical opinions and everybody's kind of telling them the same thing, then they'll realize, hey, they probably need to look into how to treat this through therapy and medication as opposed to through surgery.
Right, absolutely. Are there other psychiatric conditions that are associated with maybe BDD or other things that kind of drive people to get something like plastic surgery time and time again?
Yeah, I mean, I think that BDD is going to be the most likely in terms of the repeat people who are getting multiple surgeries. I think by number, depression and anxiety or anxiety disorders, are the most prevalent. So by number, I think that you'll probably see a lot of people that have generalized anxiety just because it's so common in the population.
Yeah.
But general anxiety wouldn't necessarily be any reason to second guess or to be worried about, performing surgery on somebody. Same thing with major depressive disorder, as long as they weren't having any suicidal ideation. I think that if there was a delusional disorder or they had some psychotic component, you'd probably be able to tease that out during the eval and meeting them. And, if they wanted something that was very bizarre or if they just weren't, grounded in reality, I think that would be a reason for people to have surgery, but you'd probably be able to tell that apart. Personality disorders, but that would be really hard for you to figure out in a one-time evaluation.
Yeah.
So I think that the most likely thing that you would see that would be a red flag is BDD more than anything else.
I see, I see. And is there any nice way to like tell someone, hey, maybe you should go see a psychiatrist prior to your surgery? Because I haven't figured out a good way to do it. Because I also worry that even if they don't have surgery with me, but if I say something like that to a person, that they might get upset that I even mentioned that, and then just go and like trash me online or whatever people like to do.
Yeah. No, I think it's kind of normalizing the whole process. I mean, for you, if you're doing, a facelift or you're doing something cosmetic on that face, taking a step back and thinking, well, what's really going to happen after this procedure is over, right? It's going to change the way that you look, hopefully in a positive way. It's going to change the way that you perceive yourself, hopefully in a positive way, but it's going to be a huge adjustment for you. And all of these huge adjustments are a lot easier if you're able to process it ahead of time and prepare for it and to think about it and to have somebody who's a trained, skilled professional who can talk to you about what this is going to be like and what this is going to, be for you, so that I just say I recommend to a lot of people that before they have such a procedure that they should be in some kind of therapy just so that they have a sounding board and somebody to process it and deal with it. And I will work, in collaboration with them. If there's, if they have any questions or if I have questions, it's great to have that. But it's something that I strongly recommend to almost everybody who comes in here because it's a drastic change. And I'm sure you've seen in your practice where it is a drastic change. I would think that when
Yeah.
people have surgeries, especially when something that's brought them a lot of distress or anxiety for a long time, when they have the surgery done, even if it goes unbelievably well, it's going to change them in a positive way that could be a huge shock to their system if they don't have somebody who they could process it with.
Yeah, no, I agree with you. I think it could pretty much help most people, especially like in the recovery phase. And that was one of the other things I wanted to touch on. Because when people recover, especially from a facelift, they're bruised, they're swollen. It could be a week, 2 weeks, and sometimes the swelling can linger even longer. And, the incisions take time to heal, even if they heal beautifully down the road. I always tell people it's a gradual recovery of the incisions. And because everyone asks about downtime, they think
Mm-hmm.
like, well, whatever I'm going to tell them, that's how long it's going to take to recover, and that's it. And I always tell them that the downtime is very subjective, and it can take a year for the incisions to fully heal. Yeah, during that, especially the acute kind of recovery phase, the first 2 weeks, I'd say, it's really rough on people because they went in to look better, they paid money, and now they look like crap.
Mm-hmm.
So anything that, I mean, other than, maybe having, like you said, like a trained professional that they can really talk to, anything else that they could do, that they could, I don't know, certain ways of processing that information when they're looking in the mirror after surgery.
Yeah, so this happened to somebody I've been working with rather recently, and it was, a man who had, and you could fill in the blanks. I don't even know all the details about all this, but it's a hair transplant, PRP type of procedure where he went to a lot of different people, and he had this idea that he was going to get 4,000 hair follicles done in a one-shot situation. And lots of different people said they wanted to do it in two shots, two different things, or three things, and he wanted it all done in one. So he found somebody who was going to do it all at one time,
Hmm.
and everybody warned him against it. And he said he understood, but just wanted to get it all done. And it was this 8-10 hour different procedure.
Yeah,
And of course, he had it done and was expecting him to have a full head of hair after everything
sure,
everything
sure.
happened, and it just wasn't explained what this would really be like. And it's probably a very intense procedure. It's probably very painful. It probably has a lot of recovery. And of course, when 4,000 hair follicles were implanted, he didn't believe from what it looked like that it was 4,000 hair follicles. It looked like
Yeah,
a lot less, and it just didn't
yeah,
look right. So it was a disaster. It was a disaster to his ego. It was a disaster to his depression. It was a disaster to his BDD. It was a disaster in every possible regard. And I'm trying to put all the pieces back together and, use all the CBT skills I possibly have to tell him, why it's going to get better and the positives and this and that and the other thing. So, in this situation, what I was wishing would happen, which
hmm
maybe is ideal, maybe it's impossible, maybe there's no way to possibly
hmm
doing this, but I
hmm
was hoping that there would be some way for the people that were operating on him to have really clear expectations that were
hmm
in writing. Because I think what happens when anybody goes to see any kind of surgeon is they just have this tunnel vision about their questions, about the costs, about what it's going to
yeah,
be like, and they actually don't listen to when the surgeon is telling them about what things are going to be like afterwards. And the expectations are just not matched. And then afterwards, there's no piece of paper to look at and say, this is actually what we talked about, so that there's somebody who could look and read through the guidelines and say, Dr. Linkov said that after I had my hair transplant that it was going to take 4 weeks to see this, or it's going to look like it's 2,000 follicles and not 4,000 follicles. So there was a huge disconnect there. So I think that would have probably been more helpful if he was to have an idea of, what the realistic expectations were.
yeah.
And then the second thing, which I think would be impossible, but would be great, maybe this will happen in 10 years, is if
Mhm.
there was some way with graphic design to figure out a way to show them realistically what
Right.
this is going to look like after they're
Yeah.
done. Because if it was on paper and you could show them what the modeling is, that would be amazing, as opposed to, a piece of paper with some pen marks in it. So I
Yeah.
think that those ways would be helpful. And
Mhm.
I'll pause there so you could, jump in and actually tell me what really happened in this
Yeah, I'm
situation.
writing down like
Yeah.
little bullet points
so
for
you could,
myself to remember
so you
what
could
like the
really tell me,
things.
and then I'll jump in afterwards and I'll tell you, other ways that the patients could manage the situation better in the recovery. But those were, that was a real situation that happened in the past few months, and that was,
Wow.
it was a traumatic event for the
Yeah,
patient, and
of
no
course.
question, it increased, his suicidal thoughts, and had real concerns about looking the way that he was looking. But I think that
Yeah.
it was either explained to him or it could have been explained to him in a way that it would have made him a lot more comfortable seeing what he did after the surgery.
Sure, sure. So how long after his surgery did he come see you, approximately?
Oh,
Are we talking about
within
days, weeks, months?
days. That was definitely days.
So, just to tell you a few words about hair transplant. So
Hmm.
it takes a year. Not like a year like I was talking about, the incisions kind of fully healing. I mean,
Hmm.
much sooner than that, you know, they start to look good. With the hair transplant, though, for the actual hair to grow out, because of the way the hair cycle works, we tell people, if they're properly educated before surgery, like you said, 4 to 6 months for the hair to start growing. And then it's just, you know, baby hair. So the initial grafts that are placed, the shafts actually fall out after a few weeks. So if you don't tell people that, then they freak out because now they've like lost what you planted.
Hmm.
But that's normal. And then ideally the actual bulb, stays in place. And then at 4 to 6 months is when the hair starts to grow out. And it takes a full year. Like I just saw a post-op 1 year patient, just took pictures. I'll probably post very soon. But that was a year out,
Hmm.
and that's how long it really takes for the hair to fully grow and for you to be able to judge the outcome of the surgery. So you can never do like a revision hair transplant at 6 months. That's like not even, I mean, if you know anything about hair transplant as a surgeon, like you would never do that.
Hmm.
So yeah, so I agree. Educating patients beforehand, super critical. I actually rewrote my entire website during COVID because like there was nothing better to do. So
Hmm.
every page I rewrote and put a lot of like time and effort into really describing like the recovery period. So this way there's like, it's not like, oh, did you get, the email with the pre and post-op instructions? It's all there. Just go to my
Right.
website. And
Hmm.
it's much easier that way. And then hopefully people can find it, who aren't even having surgery with me, but it's like really descriptive. It's not a content writer who put it together. It
Hmm.
was me. And my wife helped out a little bit. So yeah, so that I think is super important, like you said, with educating them, giving them, just like the truth about what to expect. Now, computer generated images. First of all, there's no great software for hair. So it's
Hmm.
really tough to kind of give them a realistic idea just because I guess the technology is just not there. The only surgery that I do the computer renderings for is for rhinoplasty. And that's not to necessarily show them like this is what you're going to look like, but to make sure I understand what they want. Because it can be very difficult with rhinoplasty to really understand what the person wants, like how much slope do they want, how much projection. If I show them what's realistic, I don't give them a perfect picture. Like if
Hmm.
if the nose is off centered, I'll
Hmm.
make it, instead of center, I'll bring it about 75%. And I do it on purpose. I don't tell them I did that. And then I have them look at it. If they tell me, oh, well, it's still not straight, I'll tell them, well, this could easily happen to you. It
Hmm.
may not be straight afterwards. And if they're unhappy with the pictures I did, I'm like, thank God, that I didn't operate on them. And then we part ways, and that's fine. Some surgeons don't do renderings for rhinoplasty, and they're very successful and very busy surgeons, and it works for them, and that's fine. Because people don't want to give these false kind of hope, right?
Hmm.
But for me, that's the only surgery where I find that it's truly useful. For things like aging face procedures where you're like going to be lifting things, you don't know exactly how it's going to look after, and you sort of know what they want and you know what you want to achieve. You kind of want to achieve maximal lift without, being dangerous or making it look completely ridiculous. But rhino, I think it helps. Hair is a really tricky. I mean, you have to know what you're doing. Like, I mean, hair, it's a whole, we could probably talk for an hour about sort of like why people don't have a good idea what they're getting themselves into. And a lot of it stems from the different hair clinics that are out there that where the doctor doesn't exactly know what they're doing and they rely on hair technicians to essentially do the entire procedure. And that is a huge sort of rampant problem around the world, not just in this country. There aren't that many like well-trained hair transplant surgeons that are really involved during the case because, like you said, it takes all day. I mean, even if
Hmm.
it's not 4,000 follicles, that's the other thing. It's the wording, it's the marketing, right? 4,000 hair follicles could technically be 2,000 hair grafts because each graft contains, on average, 2 hair follicles.
Hmm.
So if you're trying to, upsell somebody, you can tell them, I'm going to give you 4,000 hairs. And that sounds amazing. And you tell them, I'll do it in one day, which is quite, literally impossible. But the 2,000 is something that we do all the time, but it really does take a long time. So yeah, you have to prepare people. I've heard some clinics telling patients that, you get out of here at lunchtime and you go back to work and you're fine. And then they realize,
Hmm.
oh my God, I'm swollen, I'm bruised, I've got blood coming out the back of my head. Like, so yeah, you got to just tell people like don't plan anything. Like
That's the
take
other
take
problem.
a
So
week off.
Exactly. So you talk about other ways to prepare is that you've got work. And when people don't realize that it's going to take a week to recover and they're thinking that they're going to go back to work after sitting through a 10-hour procedure like this and go to work the next day, one, the work stress is going to pick up. So they're going to be really overwhelmed from that. And two, they're going to be really disappointed and unhappy because they all of a sudden thought that, they could tough it out. They go back in a day or 2 days, it wouldn't be so bad. And they really didn't understand, how intense a procedure like that is. So when there's a mismatch there and it gets into their work situation or in terms of their romantic situation or in terms of family situation, it creates an absolute disaster, especially if the patients are not really listening to the directions or to the expectations that you would want them to hear.
Yeah, yeah, for sure. And someone asked while we were chatting about the lip lift surgery I do, and if I notice that patients tend to be more depressed, either I guess before or after surgery. And not really. I haven't found that in my practice, because obviously I get a full medical history. I know the medications that they're on. And so no. But I would say that going back to what we were talking about, most of my lip lift patients want it for themselves. I mean, most of the time their husbands are trying to like talk them out of it or say like, honey, you look fine. Like, what do what's gone into you? What is this that you want? And they really just, they feel like, for different reasons, that's what they want. And so they're driving the conversation. And no, I really haven't, at least from assuming that they've been honest with all their medical history, no, I haven't noticed any increased rates of depression.
What's interesting, and I don't know if there's any evidence about lip lifts, but there was a study, and I don't remember any of the details about it, but there was a study that was done about Botox in a certain area in your face and depression, that there was actually evidence to support that Botox with certain
Decrease.
muscles decreased depression. So
I
I would
saw.
wonder if there was anything that's to do with, lip lifts and depression. I never looked into it before. Botox is probably a lot more prevalent and common, but it's just interesting to think. I would think it actually, if it's done well and the patient's happy, I would think it actually could improve your depression.
Yeah, I mean that's exactly like going back to like the initial sort of my opening statement about sort of why people come to me in general and why I do what I do. I mean, I find that I can really help people just feel better about themselves, and it really works. I mean, if the satisfaction rate was low, like I would not be doing this job. So yeah, I mean, most people are happy, and it things last, and they go about their business with like I guess a more optimistic mindset or whatever it is. But yeah, that hasn't been studied for lip lifts. It's I mean, it's not a new surgery, but it's newly, I guess, popularized. I haven't seen. I mean, I know like I got I did a research paper on it in fellowship, and so I had to do all the research on everything related to lip lifts, and I still track it on Google Scholar and all that. So I haven't seen anything like that, but it's yeah, it's definitely something along with other surgeries on the face. If it's done well, very high satisfaction rates.
Mhm.
So
And do you
yeah,
ever offer a benzodiazepine prior to surgery in case people are anxious in the room or in the procedure room? Is that something that you talk to them about, or is
I
that something
do.
that you don't often offer?
I do. So the biggest hindrance there, especially for like a in-office procedure where I don't have to go to the operating room, because for the OR, they're always going to get at least oral sedation for whatever
Hmm.
it is, or else I wouldn't be going to the OR for it. And then they know they have to have someone accompanying them, and to go home and all that. For like the office procedures that I do, like hair transplants and lip lifts, people don't always bring someone to take them home. With hair, actually, usually I require that as well because it's such a long day, and they almost
Hmm.
always get a benzo. And also Ambien is what I use as well, just to kind of like, especially for the first part of the day when they're laying on their belly for a few hours, just so that they get a little sleepy and groggy, and it helps them get through it. But yeah, Valium I offer for just regular office procedures. But most people want to come in on their own and then just leave and take an
Right.
Uber. I don't want them doing that if they just had Valium in their system.
Hmm.
They usually do like 5 milligrams, so it's not like terribly low
Yeah.
dose, whatever. So yeah, but that, I mean, I do kind of discuss it with them. But most of my patients opt out and they're like, I don't want any extra medications, and so we just do straight local. And again, that there's an art to that too. I mean, if they're comfortable when you're injecting, if you do it in a nice like steady way, usually it's not too painful, and then they're numb. For the face is not too difficult to numb. It's actually harder. Like I also do like body hair transplant, like taking from like the chest and the neck. Those areas are harder to numb. There's no like there's no good like regional block for
Hmm.
those areas. So you're just having to like go with like your needle everywhere, and it's more challenging. And the scalp as well, you kind of have to go around the whole thing to make it really numb. But the face, like you can just target one of the main nerves and get them numb right away. So yeah.
Because I would imagine too that would also ease some anxiety if they knew that it's an option for them. If they think about it, if they're going to be anxious, the day of, if they want something to calm themselves down, that if they had a benzodiazepine, whatever it is, Valium or Klonopin that they could take, so they know that they could ease their mind. Definitely helps people's anxiety just knowing that they can prepare ahead of time, so there's less anticipatory anxiety.
Yeah, no, great point. Excellent. And then I just wanted to chat about some of these procedures, aesthetic procedures that are done, not by the majority of us, but there are some folks who do these procedures where it's more like body modification type surgery, like creating like an elf ear. There's actually surgeries that fix elf ears for people who are born with that. But then there
Mm-hmm.
are those who want to look like, Captain Spock or whatever. There are people who want to have a tongue that gets like split in half so they look like more like a lizard, or like horns, like with these little implants under their skin on their forehead. I mean, I honestly haven't had anyone come to me like asking for that surgery, but I know it's out there and there are plastic surgeons who do them. I
Mm-hmm.
mean, what is it? What do you think it says about, I guess, the individuals, but also the surgeons who are offering those procedures?
Yeah, no, that's a challenge because, I mean, first, I would always be looking for any psychotic process. And BDD, there's two different versions. You could have BDD with psychotic features. So you want to make sure that there's no psychosis going on, that they don't think that they're a unicorn, or they don't think that, they're whatever it is that the cosmetic surgery is going to try to get them to look like. They have to be grounded in reality. And if they were, or you were concerned that there was some psychotic process, definitely that's when a psychiatrist and or potentially hospitalization is going to be warranted, and that's not the best place to be doing surgery.
Yeah.
And just assessing their capacity to make the decision, in terms of what do they understand of the risks, what do they understand as the potential benefits. Is this something they've been thinking about for a while, or is it something that's this fleeting thought that all of a sudden they're becoming reactive and they just want to get this surgery done. So I think that if they understand the risks and the benefits, that they're thoughtful about it, that there's a reason for it. It's hard to say that we should be the
Hmm.
gatekeeper to prevent them from doing these things that ultimately, they'd really want to be doing. There's a lot more dangerous things. They could always have a revision, or they could always have another surgery that they're doing it in, hopefully good, capable hands, as opposed to, people that might go on these dangerous, motorcycle rides that are putting their lives at risk, by making that conscious decision. So it's hard for us to say like you shouldn't have that well thought out surgery. I think it's going to be harder for surgeons to
Hmm.
not be judgmental. And I think that that's, it's important for them to try to be empathetic and better understand, what is it that makes them want this? What do they feel like other people are going to say? How do they think other people are going to respond? And not just say, no, you shouldn't have it because you'll never get a job again, or it's going to ruin your relationship, or it's going to, make your parents really upset, but just better understand it. And then if they feel like there's something going on that sounds a little bit concerning, then having the conversation that this is, a big surgery, and just like we were saying before, normalize the idea of talking to a therapist about it, just making sure that they're consistent with it, that they're thinking about it, that they understand what's going to happen after they get it done, so they have a sounding board there. So I think it's not as easy as, my nose doesn't look right, I want to get that fixed, or I want a lip lift. It's something that is potentially a more sensitive issue, but if they really want it and they've been consistent on it, I think it would be really hard for us to say as physicians, no, we don't believe that you should have it, we don't believe in that, so we're not going to do it, as opposed to just trying to better understand how that could really make them feel good, which is ultimately our goal.
Yeah, yeah, no, it's a great answer. Someone asked a really brilliant question, which I didn't really think of for this conversation, but it's like super important, especially as we're here on Instagram Live. The question is thoughts on beauty expectations on social media and mental health for plastic surgery. I mean, there's so many people now online, and there are so many easy ways to tweak pictures and to Photoshop and use all the apps. And yeah, for sure, I've noticed that there are, especially younger patients coming in, wanting to look like, X celebrity or influencer that they see online. Uh, I guess what are your thoughts on that first? Because from my perspective, I've noticed it as a trend, but I still kind of treat them in a similar way as we've been talking about. But yeah, I just want to hear your thoughts on that.
Yeah, I mean, it's not surprising. I think that with social media, there's a lot more attention on beauty, on youth, on looking young, on looking like a celebrity. So
Mm.
I'm sure that this happens, more often now than it probably ever happened before. I think it's probably really hard because, it's potentially you have to manage their expectations. Really, are you going to be able to turn somebody into, the celebrity that they're, trying to model something from? What is it that's within your reason that you could do? What is it about the celebrity that makes them feel like it's something that they want to look like? And just making sure that they're really thoughtful about it, that they're taking the time, that, they're going home, they're thinking about it, they're coming back in, asking good questions. You're very clear with what you are capable of doing. So I think all of that is important. And then the second part is, how young is this person that's coming in? And I would wonder, what do you do when somebody comes in who, is 17 years old and has all these ideas of what she wants and has the parents' credit card or whatever it says that they could, pay. I don't know how, I'm wondering, how would you handle that situation? Because that might be different than somebody who's 22 years old who is coming in and asking for the same thing. So I think it's a challenging question. It's definitely common, and it's just about making sure that they really understand what they're asking for.
Yeah, I mean, so far, like we've had people email us, who are like, "Oh, I'm not 18 yet. Could I get the surgery?" And my response is usually like, you need to come in with a parent. I don't like to see someone under 18 without their parents. It just doesn't, because then they'd have to sign for the surgery anyway. So it just makes sense to kind of see them all together. I haven't run into that too often. It does come up in some practices for rhinoplasty because some kids get ridiculed and they've reached their sort of maximal growth at like 15, and so it's not unreasonable to do a rhinoplasty at that age, but you just have to kind of make sure it all makes sense for the patient, the family's on board, everyone kind of gets it. But that's one of the biggest sort of types of procedures where you'd see someone getting surgery younger for purely kind of cosmetic reasons. And then about like looking like somebody else, I just tell people that you have your own like anatomy, your own proportions, and we can try to get you to be a little bit more like this person in this specific feature, but you're never going to look like them. So I just kind of, I'm very like deliberate about that. And I mean, if they don't like the answer, like I had a guy come in for a lip lift who wanted like more like to be like more like Bieber and have Bieber
Mm-hmm.
lips.
Mm-hmm.
And I just said, well, they're going to be your lips, but they'll be bigger. And if you're happy with that, then okay. But so I try to kind of move them away from the celebrity discussion.
And I think it's a little bit harder too with the face because, if you're going in for a breast augmentation, it's one specific area. You kind of know exactly what you're getting, you know what you're going for, and you have an idea if ultimately what you get is what you had wanted, and it's easier as opposed to your face where there's this idea that I would think that if you get a lip lift or if you get your eyebrows, if you get something done with your face, that's going to change the way that your whole face looks. And people have this perception of what their whole face is going to look like after that. And that oftentimes can lead to some disappointment.
Yeah. Yeah, no, that's absolutely true. Yeah, it's very difficult to find people with like who have the right kind of expectations about the
Mm-hmm.
procedure. And because, and when you run a practice, like you need to keep things moving. So you can't wait for like the absolute ideal,
Mm-hmm.
mentally prepared person. But I do turn away like a good number of people who just at least aren't a good fit for my practice. I think there are practices out there, they're not really harming anyone, but let's just say they're not asking too many questions.
Mm-hmm.
And if someone's unhappy afterwards, and maybe it could have been predicted in advance, so be it. They'll go somewhere else. They'll write a bad review, whatever.
Mm-hmm.
I'm a lot more cautious for the individuals first and foremost, but also just to kind of have some, just like quality to the whole practice and not cheapen it.
Yeah, but that's also, I mean, doing something like this is very brave. You're putting yourself out there, you're talking about, how not everybody would get the surgery that they're wanting if they're not thinking about it in the right way. If you don't feel comfortable with it, if it doesn't seem like a good fit, and if you feel like their expectations are unreasonable and that you're just going to disappoint them. So I think that's amazing that you're not just willing to operate on anybody. You want to make sure that what you're able to do and what you're willing to do is ultimately in the best interest of the patient.
Yeah. Yeah. I mean, it's amazing to me that there are people in my field who like are in it for other reasons. I don't really understand that because it's, like we go through so much to kind of get to this stage. And, I think we all kind of go into it. I would like to think to med school and beyond for the right reasons, but then, something happens maybe along the way and people kind of turn. But, I like to always take a step back and think like, why did I even go into this in the first place? And we're all helping people in our own way, however we can with our, skills and interests. So that's, yeah, so I try not to kind of forget that.
Yeah, I
Yeah.
was thinking about that a little bit with BDD, is that, that there's such a high prevalence of BDD specifically in people that are going for cosmetic surgery. And oftentimes it's missed so often, by everybody. And I was wondering, like, why exactly is that? But I think that we have this, this bias that we go in there, we hear a problem, we think, this is something we could fix. This is why we
Yeah.
went to medical school and became doctors, that this is something that I'm going to really work on and try to fix and make you happy. And then you go in with that lens, so that you ultimately might miss some of the other red flags that are going on that make you realize, well, ultimately this might not be in their best interest, and ultimately there's nothing that you can do to really fix this if it's part of, a body dysmorphic disorder. But you try so hard not to believe that, because you really want to do good by them and you really want to help them, which is ultimately why we're here in the first place.
Yeah, no, you're absolutely right. And also, like in many practices, especially those who've been around for 20 years plus, there oftentimes isn't as much emphasis on the preoperative consultation. It's sort of just like brushed along. Like, okay, they saw my work online, they've heard good things, they want a book, they have the money. Like, let's just go. Like, I don't have to even convince them. I'm just going to walk in, tell them, yeah, you look good, blah blah, and then you walk out, you go back to your next surgery. But that's how these kind of issues come up. I truly believe that if you spend the time before surgery really getting to know the person and understand them and just sit with them for like 30 minutes, I think it's hard to get fooled. I mean, if you're listening, if you don't listen, if you're just like talking the whole time and telling them what they need and how you're going to do it and how you want to add on this other procedure and this third procedure and fifth procedure, then sure, you'll miss it again. But if you're really listening to why they want the surgery, what questions they have, if there are good questions and there are some not so good questions. Like when someone comes to me for, again, the lip lift, 'cause I do a lot of those, and all they want to talk about is the scar. I mean, I answer the questions, but then at some point I tell them, if you're this worried about how the scar is going to look, you're not a good candidate for the surgery. Because my patients who are happy, most of them are happy after surgery, and some of them don't have the most amazing scar result. Most of them heal very well, but some, it's maybe a little noticeable, or at least in my eye, I'm like, it could be a little bit better. But they're so thrilled with the new shape of their lips, they don't really care like what's going on right at the base of the nose, where there's usually a shadow anyway. So for the folks preoperatively who are so like focused on it and ask me, can I somehow hide it inside the nose? Can I do this? Can I do that? I tell them that's not really possible. You have to accept the fact that there will be a scar,
Mm-hmm.
and it may not look perfect. And when they keep like just ruminating on that and just fixating on it, I tell them, like, I don't think this is right for you, because I think it's the right thing for them, and it's the right thing for me. I
Mm-hmm.
don't want to do the surgery and then they're going to hate me.
Definitely. Yep,
Yeah.
and that's why you get the results that you get. That's why people, are coming out and they're happy and they have positive experiences, because you're not operating on every single person that comes in your office.
Right.
Similarly to, I do long phone consultations. I want to make sure it's a good fit. I don't want somebody to come in my office and, need more of a substance expert that, and me not to feel comfortable taking them. So it's just about making sure that you spend the time talking to them and seeing that you're a good fit before you go on and, engage in treatment with them.
Yeah. And just to give you a recent example of an email I received for like, speaking of like hair transplants and like body hair, this woman wanted me to take hair from the pubic region and move it to her head. And she said, and it's like a super uncommon request.
Mm-hmm.
It's not something that I do, but I responded back and I said, I appreciate the inquiry, but that's not something that's done. Hair typically from the head that you get from the head grows better on the head, and so that's always the first place, unless you've had other procedures which you never had before. And she wouldn't let up and just kept asking the same question. And it's just those are the people where maybe they'll find someone to do that procedure, but I think the likelihood of them being happy afterwards is rather low, because there's a reason why that's not done.
Mm-hmm.
um,
Definitely.
there's going to be little white scars in the pubic area where the hairs came from. It's not going to look good on the head.
Mm-hmm.
It's not going to be good density. It's just like you have to anticipate the problems.
Right. Definitely.
So Seth, and I know your clinic is probably like fully booked up, but you have enough patients. But in case someone would want to reach out and kind of see you, how would they get in touch?
Yeah, they could. My email is Seth Berger MD. So just first name, last name, MD at gmail.com. Or they can call me. My phone number is 646-653-3250. So I'm happy to talk to them, even if I'm not accepting patients at the time. I will definitely point them in the right direction and just make sure that they get in good hands.
Thank you so much. Anything else you want to add? I know I think we covered most of it here.
Yeah, no, I think it was a great conversation, really interesting. And it's so hard because there's not much evidence, there's not much studies for any of these things. I mean, it's so hard to say, even if a patient has BDD and they had an adverse event after a surgery, they were unhappy. I mean, they likely would have been unhappy regardless of having the surgery. So it's a really
Right.
interesting conversation and topic to have. And I just think that it's great that you're keeping these things on your radar and thinking about, who can they talk to, who can get in good treatment with them, how do we tease out between anxiety, OCD, BDD, all those things, because they're so important ultimately to their overall success. And it's good just to have
Yeah.
that on your radar when you're meeting people and interviewing them.
Yeah. Yeah. Absolutely. Well, thank you. Thanks so much for
Awesome.
doing this and
Yeah, this was
for
great. Thank you
sharing
for
your
having me.
knowledge.
Of
Yeah.
course, I enjoyed it.
Really good. So
Awesome. Very
thanks
good.
again, Seth. I
All
really
right.
appreciate
All
you
right. No
being here.
problem. All
All
right. Have a
right.
good
Talk
night.
to you soon. Good
Bye.
night. Bye.
Bye.